Hi guys. Today I'm going to talk about something that is actually very important and is happening right now in Africa, specifically the RC Congo. It is a recent outbreak of the Ebola virus. I know, yes, we dealt with this in the past, right? 2014, 2015. We had this outbreak, and we thought that we've gotten a cure and this particular virus is out of the way. But no, we now have a new mutated strain, right? That actually right now they don't have a cure for it, and it's very sad. It's very sad to see this plague wreak havoc in a country or in a community, because these are innocent people losing their life to this deadly disease, and it's very sad. Right now, what we're hearing is that there's about 1,000 people infected, and roughly 300 people now are permanently lost from this particular outbreak, which is very sad to hear. And also, why I'm also talking about this, I kind of also remember that actually in the Americas this year, actually there was another new strain of virus that was actually discovered in a cruise ship. I've gotten it, the Hunter virus. It actually killed 2 major people, and it's very sad that with the level of the human technology, actually we will still face this level of recurring plague that's actually affecting the human health. And also, one thing I found out that right there in DRC Congo, there's something that is actually taking place between the government, the health sector, and the people, is that there's becoming an increasing distrust in whatever the still on the topic of this recent Ebola outbreak in the RC Congo. What I've actually found out is that there's a level of mistrust between the masses of the population of that country and the medical institution that are meant to provide medical relief for these people. And actually, will I say that the distrust is being wrongly placed? No. We have seen the level of misinformation, the level of distrust, and the level of manipulation that have happened from the government to the people, and that's why I think that is people have the right to doubt whatever they say. For example, let's look at what is playing out. Number one thing, when I begin to study all these viral diseases that have a massive outbreak on the masses, I found out, number one, that these viruses did not actually originated in the 2000s. Most of them originated in the 90s and in the 80s, and till this point we have not had a total and complete cure for them. For example, why did they keep mutating? Every time we thought we have a particular cure for one, it mutated. Secondly, I have found a team that is playing out throughout this virus, how they are being released to the population. Number one, you hear the story of animal to human transmission, right? That was exactly the same story that we had even at the early stage of the COVID-19. But when further investigation was done into the COVID-19, we found out that it was actually made in a lab in Wuhan, China, before it was leaked out into the population. So definitely you could see that these viruses are actually now becoming a weaponized instrument against the masses. So that's why I will say that the distrust of the people for the medical institution and their vaccination is rightly placed, because the institutions has not been actually sincere and forthcoming with these people, and that's just the truth. And that's even the saddest part, because when we have such an outbreak right now, we are supposed to have a place where we can go to seek medical help. But if the government and people there's a distrust between the government and the people, there's really a big issue to be solved. So that's what I have to speak on today. I will see you in the next video. Thank you.